That was... Did you just wave with your tongue?
Yeah.
Welcome back, everyone. Face Duo, Brandon Dunn.
From Chapathy.
And today we are going to talk about the truths behind a facelift. These are the must-knows. These are the things that you should know before getting a facelift. Shall we?
Okay, let's just break it down.
Oh, yeah.
What is a facelift, right? A facelift, you might think, is like your whole head.
Yeah. Yeah.
And some places will do that. Like they'll have a name for a procedure and it'll be like, it'll include your brows, your eyes, everything. Realistically, if you just look at the term facelift, it's about to the mid cheek to the neck area. It's a face neck lift that includes the middle of your cheek, the jowls, the saggy neck, this area. So clarify that first with your surgeon if that's what they mean, right. Facelift, because others may say, well, we just include everything, or others might say, well, we don't because you don't need all that other stuff. Right. So that's the facelift part. But what's the truth about the expectation? What can patients expect in terms of their result?
Yeah. So I'd say facelifts are probably one of my, facelifts are probably one of my favorite procedures to do because I think that it brings, the thing that I love most about a facelift is it brings you back to a time that you had once before. It's not necessarily a transformative procedure. It doesn't change how you look. It brings you back to a time that you were previously familiar with. And so I think that that's like a very rewarding, satisfying kind of... Really? All right.
Let's just continue.
Yeah. Okay. So I think that to me, I think that's an extremely satisfying part of the procedure. You know, when someone says, oh, I look like I looked when I was in my 40s, or, you know, I think those are probably one of the crazy things. But let's see, let's talk about it. Does everyone look like they looked like they were in their 40s if they were 50 or 60 when they're getting a facelift? What do you talk to them about the expectations of a facelift?
So there are some anatomic things that we look at, right? If your face is what we call heavy, not fat, just a heavier face, meaning you have big salivary glands, big masseter muscles, a thicker neck, this can make it hard to achieve a like sculpted, really contoured neck versus somebody that has a little bit of jowling, has a little bit of laxity, but a super strong jawline, right? We're basically anchoring these types of lax structures along that jawline structure. So there are some anatomical considerations, and that's what I talk to everybody about. Some people I'm like, hey, you're going to get a phenomenal result based on your anatomy. Others I'm like, you know, I'm going to do the best I can based on this, but these are the things that you can expect. And always, of course, under promise, over deliver to the best of our ability.
Right.
The other thing that I would say that I really, really hone in on is, what are your expectations? Like that's the most important thing. Are you expecting like that you'll only be happy with a particular look? And that's important to know. And what we talk about in consultation is age. People say, look, make me look 20 years younger. And I tell all of my patients, I don't believe that surgery makes you look younger. I think surgery makes you look the best you can at your age. And so my goal is never to make a 60-year-old look 40. It's just to make the 60-year-old look like the best version of a 60-year-old. You may not have always had actually a super chiseled jawline, but I might be able to get you there. But I don't necessarily think a chiseled jawline is going to make you look younger. I think it'll just make you look a little refreshed. You had a full night of sleep. Maybe it looks like you got your hair done, but I don't think it's going to necessarily make you look younger per se.
Yeah. Yeah, I mean, I think it depends on the person, depends on their anatomy. And I'd say one of the other things that is extremely important that it depends on is your skin quality. A facelift is a skin quantity procedure. It's not a skin quality procedure. It removes extra skin. It doesn't change the quality of the skin. There are other procedures that are very important to do if you want to improve the overall quality. But for individuals that take really good care of their skin, have really nice overall complexion and nice fine line, I mean, just a specimen.
Yeah.
Yeah. He couldn't get through the door this morning because his head is so big. But yeah, so I would say if you have really nice skin quality and skin texture, then I would say your result will tend to look a little bit better. And I think that you will set the clot back a little bit. Another thing to kind of add to that is a lot of people ask how long a facelift lasts. And I think
good segue.
Yeah, exactly. You know, the thing that we do is we as I tell most of my patients, is we bring the clock back 5, 10, 15 years, depending on your anatomy, depending on your skin quality, and then you continue to age. And so your investment, how well you invest in your investment of getting a facelift, is extremely important for how long the longevity of the procedure actually lasts. And so, diet, exercise, smoking, drinking, eating healthy, low salt diets, all of these different types of things are really important to make sure that you invest in yourself after you've had this procedure, and then your result will last a lot longer.
Yeah, I'm maybe a little more, I take a different approach for the lasting part. I think I always tell people the question of how long does it last is really a question of how long before I get back to now, right? Get back to this anatomy that I currently have. I think that's what people are worried about. And for all intents and purposes, surgical procedures are permanent. That muscle will shouldn't be as lax as it is now. That skin that we remove will never come back. But you still age, right? We don't have a way to stop the clock. So even though we are making you look refreshed, time will continue to pass. And so even if in a surgery lasts 10 years, in 10 years, you'll always look better having had it done than not. So that's what I tell. The analogy that I think that makes the most sense, which is very crude, and you hear me say it on many videos, is if you come in with your twin sister or brother, whoever they are, and you have the surgery and they don't, even in 20 years, you will look better. If you took care of yourself, you will still look better. You'll have age, but you'll still look better having had it done than not. So it is really a matter of it's not a matter of one day, 10 years from now, looking in the mirror and the entire thing is gone. Your body just doesn't work that way.
Yeah, definitely. Another thing that I think a lot of people ask as far as the expectations for a facelift is their downtime.
Yes.
How much of time of their life, work, life, family, all of these different types of things do they need to invest and stay away from all of these people?
So what do you say? Oh, you want me? Okay, I'll make it fast.
Yeah, please.
It's a social downtime. So I want you up and about, cooking dinner, doing things around the house within 24 hours. But it is social downtime, meaning bruising, swelling, maybe you don't want to be seen. A couple weeks until you're presentable, meaning sutures are out, most of the bruising is gone, you can wear your hair down if you have longer hair, and a couple of months before you absolutely look red carpet ready, like you could go to an event. Even if you were planning an event, I would still give it 3 to 4 months ahead of time just in case something happens. But couple weeks and couple months. But remember, it's social. So if you've ever had surgery on your abdomen, you've had your appendix removed, you've had some other bigger surgery, you have a physical downtime where it's hard to get up and get around. This is not the case with a facelift.
Yeah, I would say restaurant ready is one of the terms that I kind of throw around a little bit, and I think a lot of people throw it around.
Included.
Yeah, exactly. Don't use it.
Yeah.
I'd say most people are restaurant ready around 2 to 3 weeks. But the one thing I will add to that is everyone is different in their healing process.
For sure.
I've talked about this before. There are hills and valleys in the healing process. And one of the things is I've had patients look so good at 2 weeks, but they emotionally just don't feel ready. They still have some swelling. Their incisions look a little bit pink still, but they're not ready to go out and about until 4 weeks. And it's wild. And I've had patients that are at 5, 6 days and they look fine. Yeah. And they're out and about, they're at the grocery store, they're doing their thing. And so it really does come down to your comfort level. And so yeah, I would say, on average, it's around 2 to 3 weeks. The one thing that I typically say is I say, you look pretty good around 2 to 3 weeks. You look really good, or I'd say you look good around maybe the 6 to 8 week, 2 to 3 month mark. And then around the 3 to 6 month mark, I'd say that's when you're looking top.
Yeah.
So,
what about precautions? So we say you can go out and go to the restaurant.
Yeah.
But what precautions do you give your patients, which may or may not be based on evidence, but are based on our expertise and based on your own patient?
So what I tell my patients every single time is I said, this lift is held with sutures. The sutures are only as strong as they are made, and you can pull through, you can damage the results if you are too aggressive too early in the process. There is scar tissue that needs to form to make sure that these results in this lift stays where it needs to stay. And so if you take that leap too early, if you're out moving your head, doing crazy yoga maneuvers, you're stretching, you're driving, and you're extending your neck, these sutures can actually pull through. It's not common that happens, but it can happen. And so I'd say most people, generally what I say is you're up and out and about in your house, maybe in your neighborhood for like the first week or so, that once those sutures come out, the external sutures come out. And then I would say between 1 week to about 4 to 6 weeks, you start slowly increasing your activity level, getting back to your full activity. Yeah, what do you think?
Yeah, I mean, similar. I give him a 3 weeks of no strenuous exercise.
Yeah.
Yes, the scar tissue needs to form to hold the things in place. Your stitches probably won't rip, but your muscle can tear through the stitch.
Definitely.
So that's what we don't want.
Yep.
So nothing, I don't want you moving your head past about 30 degrees from here being 0 degrees. This is 30 degrees. So no, jujitsu, no like yoga, no like really big heavy lifting, like, bars or like overhead pull-ups or anything like that for 3 weeks.
We can tell you do that.
Yeah, all the time. Obviously, clearly, I'm a perfect specimen. But I think the harder part is, in my experience, the patients that tend to be the most bothered by this restriction are the ones that are very physically active, which are most of our patients.
Right. And
the fact that at 1 to 2 weeks, you feel pretty good.
Yep.
The anesthesia's out of your system. You're not super bruised. A lot of the swelling is gone. And so you think, well, I feel pretty good. I don't look that bad. Why can't I go back to the gym? But you have to realize that now you're on the flip side. Your body is not fully recovered. So you are at risk for damaging the investment. So if you're going to have surgery, protect your investment, protect all the time, energy, money that you put into this. And remember, it's only going to be as good as your post-operative care. So you've got to listen to our orders, even if they don't make sense. And even if to us, sometimes they don't make sense. Like the 3 weeks is sort of a random number, right? We know that 3 weeks, there is more scar tissue that's formed than at 1 week. But is it the same for everyone? No, but we really have to use our experience and the experience of others to come up with the stuff.
Yeah, there's no scientific evidence to say like, this is what you have to do.
Right.
And I think it really is based on your intuition, your understanding of the materials and sutures that we're using, our experience, and again, the things that we have learned. So it's super important to follow these instructions, definitely.
Yeah.
All right. Well, so just to recap. So what are we recapping again?
The common things, the whole skinny on facelifts.
Yeah. Okay. So biggest thing is, what to expect, how long the results are going to last. It ultimately depends. But overall, I would say we set back the clock and you continue to age gracefully. Overall,
Are you going to need a revision?
No, I'd say revisions tend to be uncommon. But
if you get we have to include this. What's the best age? That's the biggest question.
That's one of the best.
Best age and we've done a video on this, but what is the best age to get a facelift? And everyone says, should I get a facelift at 40? If I'm going to need one at 60, should I wait till I'm 60? Should I only need to do it once?
Yeah.
What do you say?
What I say, just to kind of make it really simple and easy, if you find yourself in front of a mirror and you're doing this, or doing this.
I do that already.
Yeah, I know. Well, you need a facelift tomorrow.
I know.
If you find yourself doing that, then honestly, you're probably starting to approach the age of needing a facelift. And I think that's kind of like simple and maybe not as comprehensive. But I think that's kind of like where it starts. And some people, it's in their 30s. Some people, it's in their 40s. And some people, it's in their 70s and 80s. And it doesn't matter. It's your anatomy, and it's when you're emotionally, physically, and mentally ready to do it.
I agree. I mean, I think the thought of not wanting to do it again, but being bothered now, you don't know how long you're going to live. I mean, you might have to do it again, but if you're bothered by something now and you're mentally prepared to have surgery and you can financially afford it and you have the support system to heal, then you should do it when it feels right for you. I always say the second most important thing to me is the anatomy, but the first most important is the mental preparation for surgery, right? Because this is not just some decision that you make, a cavalier decision, right?
Right.
But it doesn't make sense to me to think, well, I'm unhappy now, but why don't I wait 20 more years so that I only have to do this once, right? If you do it earlier, you have more time to enjoy it. That is the other, argument, right? If you do it later, then maybe you only have to do it once. So there's two sides to the coin, but the preference really is just on you to decide. We can't make that decision. What works for you. We can just tell you whether you're anatomically a candidate, which again goes back to whether you can do this and whether you see an improvement that you like.
Can I add one more thing to?
Of course.
Yeah, I feel like I always have to add my 2 cents. So I would say the other side is if you do it later in life, as we get older, the life that we live, the environment and exposure that we've had has changed our quality of our tissue. And so the quality of the tissue is different as you get older. And so when you're younger, the results tend to be a little bit more I would say optimal than as you get older, because again, the quality of the tissue, and again, remember, a facelift is a skin quantity, not a skin quality. And so it becomes more apparent and more obvious as the quality of our skin and our tissue kind of, I guess, weakens and becomes not as robust. And so that's one of the other benefits to doing it. I'd say, you know, most people are in between their 40s and 60s when they're getting this procedure done. We have upper limits, we have lower limits, but that's the general age.
Yeah. So to recap, facelifts are a procedure that involves the mid cheek to the neck. It's generally done under either conscious sedation or general anesthesia. It is a procedure that can be done basically at the age that is anatomically appropriate for you based on your expectation. It is a permanent procedure, but you will continue to age with time, and it should be something that you decide between you and your doctor as to the optimal time, what your expectations are, how long it's going to last, and what you can expect going forward. It's not a lot of downtime. It's mostly social, but there are some physical limitations that we give all of our patients. If you're interested in a facelift or anything surgical on the face, we'd love to hear what you have to say. Come see us in the office, drop your comments below, and we'll see you next time.